How can I understand my stroke brain imaging results? When you or a loved one experience a stroke, getting the right diagnosis quickly is crucial. Brain imaging tests like computed tomography scans and magnetic resonance imaging are key tools doctors use to understand what's happening inside the brain. But understanding what these images show can seem confusing at first. Let's break it down in simple terms so you can better grasp what your results mean. First, the most common imaging tests used in stroke diagnosis are computed tomography scans and magnetic resonance imaging scans. A computed tomography scan, often called a CORT scan, is usually the first test done in emergency situations. It's fast, widely available, and excellent at detecting bleeding in the brain. If there is bleeding, the scan shows bright white areas where blood has accumulated. This helps doctors quickly decide if a stroke is caused by a bleed or a clot. Magnetic resonance imaging, or MRI, is more sensitive than CORT for detecting early signs of stroke. It can identify areas of brain damage within minutes to hours after symptoms start. MRI uses strong magnets and radio waves to produce detailed images of brain tissue. On MRI scans, areas affected by stroke often show up as bright or dark spots depending on the type of imaging used. The most sensitive part for early stroke detection is called diffusion-weighted imaging. It highlights areas where water movement is restricted due to cell injury, revealing damage sooner than a CORT scan. In cases of ischemic stroke, which is caused by a blood clot blocking blood flow, the affected brain tissue appears darker on a CORT scan after some hours. This darker area is called hypoattenuation and indicates tissue that is injured. On MRI, these areas show up as regions of restricted diffusion, confirming recent damage. The extent of these changes helps doctors understand how much brain tissue has been affected and guides treatment decisions. If the stroke is caused by bleeding, the CORT scan will clearly show bright areas of blood in the brain. MRI can also detect hemorrhages but is less commonly used in emergencies because it takes longer and is less available. Advanced imaging techniques like perfusion scans help doctors see how blood is flowing through the brain. These scans can distinguish between tissue that is already dead and tissue that is at risk but could still be saved if blood flow is restored. This information is vital for deciding if treatments like clot-busting drugs or mechanical removal of the clot are appropriate. Blood vessel imaging tests, called CORT angiography or Mr. angiography, visualize the arteries and veins in the brain. They help identify blockages or narrowing that cause the stroke. Interpreting your imaging results involves understanding what the scans show and how they relate to your symptoms. If the early CORT scan appears normal, it might be because changes haven't developed yet. Sometimes, repeat scans are needed to see the full picture. If the scan shows areas of hypoattenuation or early ischemic changes, it indicates brain tissue damage. The larger the affected area, the more severe the stroke. MRI findings of restricted diffusion confirm recent ischemic injury, and perfusion scans can reveal areas that might still be saved with prompt treatment. Your healthcare team uses these imaging results to confirm the type of stroke, estimate how much brain damage has occurred, and decide on the best treatment plan. They also use the images to predict recovery prospects and plan rehabilitation. Because interpreting these scans can be complex, radiologists and neurologists will explain what the images mean in the context of your symptoms and medical history. It's important to remember that imaging results are just one part of the overall diagnosis. They need to be combined with your physical exam and the timing of your symptoms. Sometimes, early scans may not show all the damage, so doctors might order additional imaging later. Advances in imaging technology are helping doctors better tailor treatments, especially in the critical hours after a stroke. In summary, understanding your stroke brain imaging results means knowing that CORT scans are quick and excellent for ruling out bleeding, while MRI scans are more sensitive for detecting early ischemic changes. The size, location, and type of abnormalities seen on these scans help doctors diagnose the stroke, determine its severity, and choose the best treatment options. Always discuss your results with your healthcare provider. who can explain what they mean specifically for your condition and guide you through your recovery journey.